Good afternoon and welcome to our weekly COVID-19 update for the town of Plymouth. I'm Steve Triffletti, your Plymouth town moderator, and we're here each Wednesday at noon for this update. This forum is being brought to you live by PAC TV on Comcast Channel 15 and Verizon Channel 47. You can also watch this on PAC TV's streaming channel by going to pactv.org/live. For questions during today's forum, please email plymouthinfo@pactv.org. These forums can be replayed at pactv.org/Plymouth. Today's participants joining Ken Tavares, Matt Muratore, and me include Sarah Cloud, Karen Keane, Dr. Christopher Campbell, Heather Cozby, and Stephen Cole. And we're going to begin today's discussion with the chair of the select board for the town of Plymouth, Ken Tavares. Welcome, Ken.
Good afternoon, everyone. Thank you, Steve. I want to share with our audience today something that I experienced a week ago, and maybe it'll make some of you feel a little bit more comfortable. There's been a lot of talk of going to Gillette Stadium, and it's difficult to get to, and it's very large, and maybe I'll just wait a little bit longer, to receive the vaccination. Well, I made an appointment. Initially, it took a while, to get the appointment, but once I did, I went last Wednesday, and I want to tell you, it was an absolutely phenomenal experience. I drove into the parking area with my wife, and we were really just outside the stadium. I think a lot of us are thinking this is going to be like a football game, and there are going to be cars, and they're going to place us in far off parking spaces, and we're going to have to find our way and fight our way up to get in line. That wasn't the case at all. As soon as you step foot on that property, you're in great hands. I went to the first person at the entrance, and what they do is they check, to make sure that you have the right day and you have an appointment. From there to sitting with a nurse to give me the injection probably takes not even 15 minutes. And that's with standing, waiting for a few other people ahead of you, to go. After that, you sit for another 15 minutes and, just wait to make sure that you're not going to have a reaction. And then during that time, you can also use it wisely to make the next appointment. If you wanted to get lost at Gillette, you can't do it. There's someone on every corner that's willing to help you, and even without asking, they'll come up to you and give you, some advice or something as to how you should, be moving through. I have never met nicer people that were really concerned about what they were doing, wanted to make everyone feel at ease. It's a great experience. And I know just before we went on air, the governor was talking about people 75 and older having a companion or a caregiver go with them for their injections. So this will even make it easier where you can kind of like do the 2-for-1. And you have somebody that, can look after you. From the center of Plymouth to the parking lot is 45 minutes. It's a absolutely easy ride. As I said, the people that were inside are absolutely phenomenal. They want to help. They want it to be a pleasant experience. So I recommend that if you can find something close by, Gillette's the answer. It's definitely worth the time spent in the car to get there, which even that isn't long. So anyway, I just wanted to pass that on to let you know that it's not a monster that some people have made up in their minds. It's easy to get to, and it's easy to take care of the injection. Thank you.
Thanks, and that's Ken Tavares, chair of the select board. And Ken, I have a friend who's an essential frontline worker. He went to Gillette. He had the same positive experience, and I can share with viewers that I had a very good experience at Walgreens, as did several members of my family. So we're now going to welcome Sarah Cloud. She's going to start our medical segment. And this is a good segue for you, Sarah, because we're talking about the vaccines. And despite what Ken has shared and what I've shared, we know that a lot of our viewers have stress about the vaccines. What can you do to help us through this?
Yeah, no, I think this is a good question and it's a challenge. And I think in particularly with the focus on when and how our teachers and our educators will be vaccinated is a really important piece of this as well, especially as the debate rages over when it's safe for our children to resume in-person classes. I know each state is managing the prioritization and process of vaccinating their teachers a little slightly differently. Here in Massachusetts, the vaccination plan reflects several priorities, and according to mass.gov, these priorities are protecting our most vulnerable, maintaining healthcare system capacity and addressing inequalities in healthcare access and COVID-19 burden. So in this plan, educators are included in phase 2, group 3. And this is very stressful and challenging, I think, for both teachers and parents alike. So how do we deal with the stress as we wait for our valued teachers turn in the vaccination line? And since we've been at this for over a year now, I'm keeping my message simple and consistent. For our own well-being, we need to sort through and categorize what is within our control and what is not within our control. So we may not have control in the decision-making process, but we can advocate for our beliefs and needs by reaching out to our legislators. How quickly the process rolls out and the availability of doses is another area that we do not have control over as a general population. But we do have control over wearing our masks, physically distancing, and being kind to others. The other area that we always need to focus on is our own well-being and focusing on, trying to get enough sleep, eating well, exercising, and most importantly, caring for others. Thank you.
Thank you. And that's Sarah Cloud, and she is Director of Behavioral Health at Beth Israel Deaconess here in Plymouth. She'll be available to answer your questions. Please go to plymouthinfo@pactv.org. And at this time, we welcome back the Plymouth Director of Public Health, Karen Keane. Karen, we're talking about vaccines. Where can people go locally? And unmute yourself, Karen.
Yep, thank you.
There you are. Thank you.
So I have some good news I'd like to share with everyone about vaccines. I know it's a frustrating topic, but I would like to remind everyone that there have been several groups that have already received vaccines here in Plymouth. We have done our first responders, police, fire, and EMT, harbor masters, marine environmental affairs officers, all of our school nurses, drivers for Meals on Wheels, our homeless population, the congregate living areas, low-income housing seniors, and we are currently working on mapping out our homebound residents, not just senior residents, but all of our homebound residents, and working with Brewster Ambulance so that we can deliver vaccines to people who are not mobile and cannot get to a vaccine location. Other good news I'd like to share. Share. That's not being shared. Okay. Share my screen. Here we go. With vaccines are, as of Monday night, 910,412 doses had been administered to residents, and over 1.2 million doses have been shipped to the Commonwealth of Massachusetts. Of those doses that have been shipped, 70% have been reported as administered. So I think there's a misconception that there's some hoarding going on perhaps of vaccines, and I want people to be rest assured that the vaccines that are here in Massachusetts are being distributed to people who need them. As of tomorrow morning at 8:30, 53,000 new appointments will be made available at mass vaccination sites at the Eastfield Mall in Springfield, Gillette Stadium, and Fenway Park. Also, during the course of the week, 50,000 pharmacy appointments will be added on a regular and daily basis and another 14,000 appointments will be added at 35 community health centers across the state. Other providers, such as healthcare providers and local vaccine clinics, are adding almost 40,000 appointments over the course of this week. All appointments, again, must be scheduled online by visiting mass.gov/COVID vaccine. Residents over 75 can call 211 to get help booking an appointment if they're unable to use the website. Also exciting news, 2 new mass vaccination sites will open later this month. One will be in Natick at the Natick Mall, which will open on February 22nd, and the other will be in Dartmouth at Circuit City, which will open on February 24th. Appointments for both of those new sites will be available to book on mass.gov beginning Thursday, February 18th. And we mentioned, Mr. Tavares mentioned about the 75 plus caregiver eligibility. This is very exciting news. Starting February 1st, with vaccines for residents 75 and older began. This new policy goes into effect on Thursday, February 11th. It's to support more 75 and older residents getting to a mass vax site. So they are allowing one caregiver to join the 75 plus resident and schedule their own appointment for a vaccine at the same time. Any caregiver is eligible to receive the vaccine at the same time as the 75 and older resident, provided they make an appointment. So they still have to go through the same process of booking an appointment online, but they can be under the age of 75 because they're acting as a caregiver to someone who is over the age of 75. Appointments for the 75 plus resident and their caregivers should be scheduled for the same day, as close together as possible. If both the caregiver and 75 plus resident are unable to use or have difficulty accessing the internet, they may call 211 for assistance booking both appointments. And the other item I would like to share quickly, as far as vaccines are concerned, is the public relations campaign that the state of Massachusetts has started and will be running for the next 5 months, which is trust the facts, get the vax. And if anyone was watching television prior to the beginning of the Super Bowl, they may have seen this very brief commercial, which I'd like to share with everyone right now, which is talking about trusting the facts and getting the vax. So here we go.
The COVID vaccine is a critical tool to protect yourself in the pandemic.
But you might have questions about its safety. The same safety measures used for all vaccines were used for the COVID vaccine. Tens of thousands participated in vaccine trials.
Since then, millions of people of all races and ethnicities have gotten the vaccine and experienced only mild side effects. I got the vaccine to protect myself, my family, and my friends. When it's your turn, trust the facts, get the facts.
So one of the questions I know that will be coming up, and Representative Muratore, I think, is going to address this as well, is now that we have all this information about vaccines, why can't we have a site that's closer to us here in Plymouth? Again, I think it's important for folks in the audience to know that we've been working on a vaccination site here in Plymouth for months. This isn't something that we've just started doing, but you have to work through the proper channels. We've offered a couple of locations for a site, working with the state of Massachusetts. We're also working with some private medical practices to perhaps assist in vaccinations when we get to the general public. And we recognize here at the Department of Public Health that there's a frustration level regarding limits to vaccine and the supply. But we encourage folks to remain diligent in working with the state's website, making the appointments when they can, ask for assistance if they're having trouble booking them on the computer, and know that we're doing everything that we can here at the Department of Public Health, working with our state representatives and our town administration to hopefully bring something closer to our residents soon. One final note, which does not have to do with the vaccines, I just want to add really quickly, has to do with youth and amateur sports. This is also good news. Our numbers are getting better. The governor is relaxing some of the restrictions, and one of the restrictions that's being relaxed is the fact that spectators will now be allowed. 2 adults will be allowed to go to a youth or amateur sport event for every player that's under the age of 21. Children aren't included in that number. So if you wanted to bring your 2 children along with you to watch your child play a sport, you could bring your children along with you. You must wear a face mask, and the indoor facilities are still limited to 40% of their overall capacity. But that's good news because we were certainly limiting the number of people. No one could go. Parents couldn't see their children play sports, and that's a change that's coming because our numbers are improving. So that's what I have right now, Steve.
Thank you, and that's Karen Keane. She is the Town of Plymouth Director of Public Health, and she'll be here for our questions. We're now going to go to our education segment. We have Dr. Christopher Campbell. He is the Superintendent of Plymouth Public Schools, and Dr. Campbell, what Karen Keane just told us about athletic events, that's fairly exciting as you look towards the spring season for your school teams. Welcome.
Thank you, Steve. Absolutely. We're very encouraged by that. So I think a lot of our families will be very pleased with that as well. So again, thanks for having me. I have a few updates for your viewers today, but first, as I typically do, I want to start with our recent COVID cases. So this past week, as everyone knows, we report our cases at the end of the week on our dashboard on our website, which is easy to find. We had 14 new positive cases among our students, with 96 students quarantined, 6 employees with 12 of our employees quarantined. Our confirmed cases and quarantines are the lowest that they've been since the week ending December 11th. So, while we're still experiencing positive cases each week, we're pleased with the trend in recent weeks for sure. Another thing, as a district, we are initiating optional COVID-19 surveillance testing beginning this winter break. So COVID tests have arrived and have been delivered to our schools. We're actually have distributed some of them to our staff that have been in quarantine, as well as a few students at this time. So in terms of a larger scale usage, we'll be starting with surveillance testing near the end of February vacation for anyone interested in participating. We've been exploring COVID testing options for both our staff and students for a while now, and we recently became aware of this testing option that is both highly effective and very easy to manage. So it's a secure, no-cost surveillance test, which will be, again, an option for district staff and students to participate in. We wanted to get another opportunity to really assure our commitment to the health and safety of our school community while maintaining safe in-school learning for our students. So this specific test that we're offering is a PCR test, requires individual consent. It's a molecular test, so it's the most highly accurate of all diagnostic tests. It doesn't require any repeated testing. It is one thing that is encouraging to many is it utilizes saliva. It's most non-invasive, and the results can get provided within 24 to 36 hours. So again, the purpose of this testing initiative is to offer our community an option for surveillance testing, and we're rolling this out at a larger scale this week, as well as next week, having opportunities for families to pick up the tests. We'll continue to do this during the year and April break as well. So interested staff have already received their kits, and a communication is going out home today to families later to explain how they may obtain their kits by the end of the week, as well as having some opportunities next week to get them if they choose. So it's very easy. I have a kit right here. It comes in a box, very much like a DNA kit that you would receive if you did something like that. Very easy instructions to follow. You register your kit. It's individualized. The email goes to the individual that's tested, as well as to my office. It's very confidential and it doesn't get shared with anyone else. Essentially, you just put this test tube with this solution into this FedEx bag. They get it next day, and as I said, we get the results within 24 to 36 hours. So it's really encouraging, and again, another way of us to just show our commitment to maintaining good health practices in our schools. And the last thing that I'd like to share is in regards to our return to school plan, which has been communicated this past Monday. So a lot of people are very pleased with this, I think. So we sent out a communication this Monday to our entire school community regarding a return to school goal set forth by the school committee. So this past Saturday, the school committee, as well as my administrative team, held our biannual weekend meeting. And the majority of this meeting this year was really dedicated, as you'd imagine, to discussions related to COVID-19, our operational practices, what we need to consider moving forward, but spend a good amount of time talking about what we would need to consider in order to transition all students whose families chose to, I should say, but all students to a full-time model of in-person learning. So as we've said since the very beginning, education and health are not conflicting interests. So they really are dependent on each other, particularly this year. So feasibility, logistics, our local health metrics, as well as all of the restrictions and the regulations that are set forth by the Department of Education, have continued and will continue to guide our district's decision-making. You know, there's a lot to consider as how to best serve our students in ways that are safe for our students, for our teachers, our staff, and our families. But having said that, at the conclusion of our meeting this past Saturday, the committee has set a goal of returning all students to a full-time in-person learning model this school year. So at this time, we have set a goal of returning all students to a full-time model at the conclusion of April vacation, which was Monday, April 26th. So in order for this to occur, there are 4 conditions that will be examined. So first is the vaccination distribution to our early education and K-12 workers. This is very important to us and to the committee. And I'm very encouraged and very optimistic that we'll be able to set that goal, reach that goal, but that is very important. Secondly, COVID test positivity rate in our community must continue to be in an acceptable range. So we'll obviously consult with local health officials on that, but that is a second variable that needs to be looked at. Thirdly, our district must be able to carry out our transportation plans for all students that meet the Massachusetts general laws, any COVID-19 restrictions that we have to abide by this year. And I'm encouraged that we'll be able to do that as well. We anticipate some additional guidance coming from the state, but these are things that we will plan out from now until we meet again to discuss this final decision. We'll also be examining the ability to continue to use outdoor spaces. The weather certainly will be warmer, but we will maximize the use of outdoor space for teaching and learning opportunities, as well as other school activities that take place in a typical day. So the remote option, I just want to stress that the remote option that we are currently providing to families that we've been providing since August will continue for those students through the remainder of the year. We're not excluding that. All of the conditions that I just mentioned, as well as other matters related to COVID-19 and our return to school plan, will continue to be discussed not only at school committee meetings, but we will be doing regular updates regarding our status and progress on that. So during the April 5th school committee meeting, a decision will be made regarding the return to school goal that was set. And if the committee does not feel that the conditions have been met, at that time, we'll continue to reevaluate the return to school date. But I'm very optimistic about that and very encouraged that we'll be able to make that goal. So while that's a quick summary of what's going on here in Plymouth, Steve, some very important updates for everyone today.
Thank you, and that's Dr. Christopher Campbell. He is Superintendent of Plymouth Public Schools. He'll be here to answer your questions. Send them to plymouthinfo@pactv.org. Now, last year when Ken, Matt, and I planned to bring this forum to you in collaboration with PacTV, our goal was to make sure that we communicated to the community as needed on a regular basis with officials, experts, with verified, trusted, true information. Today, you've already had the chair of the select board. You've had the superintendent of Plymouth Public Schools, a representative from our hospital here in Plymouth, and the director of public health in Plymouth, all providing us with valuable information as the response to COVID-19 in Plymouth is ever changing. We're now going to our business segment. We welcome back Heather Cozby. She is a CPA in the town of Plymouth. Heather, what do you have for us today?
Well, thank you very much, Steve. It's so good to always be back. I wanted to spend a little time talking about the tax season. It's just getting going underway. So just for comparison, last year, the IRS had processed 40 million tax returns and issued 18 million refunds by this weekend. The IRS is just opening for their first return to be processed this Friday, the 12th. So, everybody continue to be patient. So that's number one. Secondly, people are concerned about errors. I'm getting a lot of communications about, whether that's the unemployment fraud and whatnot. You can go and to the IRS website, irs.gov, set up an account, and you can actually run transcripts under your Social Security number to figure out what has been filed under your Social Security number. I'm strongly encouraging a lot of taxpayers do that this year, just to make sure something wasn't reported under your number that you don't know about. Also, there's been significant issues with mailing, where a lot of these forms would come to you in the mail. Do this step, run a transcript, see what's been filed under your Social Security number, make sure you have everything, make sure there's no errors. Because if you don't and there is an error, you're going to get a notice, and then you're going to have to deal with that. So like with everything this last year, try to be proactive, try to take an extra step for yourself. The IRS also has on their website a free e-file tool this year for if you make less than $72,000. So if you have a really simple return and you just want to get it done, you could go and look at their website, look for free file, and that might be an option for you just to get things done and moving quickly. With the tax season starting this Friday, just to make everybody aware, the IRS doesn't expect to be issuing their first refunds until the first week in March. So know that that's delayed. That's a realistic time point, and that would be if you did direct deposit. If you want to get a check issued, you're looking at maybe another 6 or 7 weeks added onto that time frame. So when you're doing your returns this year, I wanted to go over just a couple of the COVID changes that happened, put everybody's mindset, start getting your stuff together. The first thing is, remember that every taxpayer can deduct charity this year. So if you normally take a standard deduction, you can take up to $300 of additional charity as a deduction above the line. So you're going to want to get your charity put together this year if you don't normally do that every year. The second thing is for our teachers. Amazing, they have this small deduction. I call it small. It's $250, but they expanded the definition of what a teacher can deduct in that expense, and it includes all your COVID supplies. So whether it's disinfectants, masks, other things going on. So I wanted to remind all our teachers that are working so hard and making sure that they're keeping everybody safe to include those expenses when they go to do that this year. The other area I wanted to go into is the retirement distributions. I'm going to spend a little bit of time on this because this is a question I'm getting. So if you were affected by COVID, you could have access to your retirement account last year and take up to $100,000 out without having a 10% penalty if you weren't of retirement age. The thing that is getting confusing about this is the form that the IRS needs to issue for this distribution to be reconciled and take advantage of the law is not ready yet. So even if the IRS opens this weekend, there are going to be groups of taxpayers that cannot file their tax returns yet because the IRS has not finished issuing forms in final format. So just know there's a lot going on. There's a lot that got passed, and there's a lot of forms being amended. So I'm telling you, you can file this weekend, but quite honestly, you might not be able to, and it might be another couple of weeks before you can file. So with this distribution, if you took a COVID-related distribution because you were a qualifying individual, which means you're affected by COVID, just to make it simple to say that, you will not pay 10% on it. You will take that distribution into income over 3 years. So if you took a $30,000 distribution, you will not be taxed on it all in 2020. You'll take $10,000 in 20, $10,000 in 21, $10,000 in 22. Secondly, you have 3 years to repay it. So this is where I wanted to make this really clear. If you repay your a 1/3 year distribution now before you file your tax return, you do not have to pick it up as income last year. So I just want you to know you have to time these things. You have to understand these things. If you're affected by this, not only if you're trying to file your tax return, the form's not there. This is an issue that a lot of people have that you're going to be patient on, and you might actually need to seek some additional assistance with. You want to take advantage of this rule, Even if you repay it all three at the end of year 3, you'd have to go back and amend your prior 2 tax returns to get the tax benefit. So it's technical in the fact it goes over multiple years. It's technical because it's new. It's a very good benefit that I want to make sure all of our local residents are taking advantage of and don't overpay their taxes for something like this. So that's the COVID retirement distribution. In general, I said last time I was on, if you have an unemployment fraud, somebody committed fraud against you related to your unemployment claim, you have to go on to the Mass Department of Unemployment website and file a form there that lets them know that the fraud has happened, because they will need to amend that form. So that's, again, something else that, is just going to be taking a lot of time this year to get through the season. On the federal level, as far as what's going on in Congress, there's discussions about a $1,400 additional stimulus payment to taxpayers. That's going back and forth right now. Even amongst the House, they're having disagreement. But something will be coming, and hopefully they'll again be able to turn that out quickly. And the last piece of information that's really important when you go to prepare your tax returns, you need to have with you the amount of economic impact payments you received. Both payments, the one last spring and the one that just happened in December, because these payments need to be reconciled on your tax return. If you're owed more, you'll get more. They just want to make sure you got everything you needed. If it ended up you shouldn't have got it, you don't have to repay it. But you do need those 2 amounts. When you're putting together this information, make sure you have those 2 payments. Any charity, if you're a teacher, get all your deductions. And then if you had IRA distributions, just know you're going to need to spend a little more time on that. So, we're excited to get going here. We're hoping things will roll out nicely, but, we're just smiling and kind of hoping for the best. But thank you.
Thank you, and that's Heather Cozby. She's a CPA in the town of Plymouth. Please send her your questions to plymouthinfo@pactv.org. Again, valuable information for all of our viewers and for our panel. As we now move to Stephen Cole. He is the Executive Director for the Plymouth Regional Economic Development Foundation. Welcome back, Steve.
Hi, Steve. Hello, folks. Welcome back to 60 Seconds of Stephen. I will be brief. I typically begin by talking about unemployment, but today I'm going to show you something because there is a visual impact to what I've been seeing that I think the rest of you should see. If you see the map here that's on your screen, you'll see that the top map was taken May 2nd, 2020. That was the height of most of the unemployment we saw in the Commonwealth. In fact, you can see that the top of the scale in the red shows that the unemployment rate is close to 40% in the deeper red areas that you see on your map. Plymouth was at a height of 18.5% at that time. Skip ahead to our latest numbers that we have available, January 23rd, 2021, and you can see a very starkly different Commonwealth. In fact, our Commonwealth is looking, our own unemployment rate is at 3.9%. That is our latest number as of January 29th. So you can see in this graphic here on your screen, a tale of 2 Commonwealths. This is how far we've come. Now, I'm going to stop sharing in a moment just so I could talk about some of the things that we're doing to prepare ourselves, because frankly, one of the things that bothers me about measuring unemployment is that it's largely determined by who is looking for a job. There may be people in our community who frankly just gave up looking for a job, and that's one of the things that also contributes to a lower unemployment rate. So one of the things that the foundation is doing, and I have to say I'm so honored and blessed to have folks like Ken and Matt on my board, because they recognize that we can't just plan for what we have happening now. We need to plan for what's happening over the next, say, 50 years. Now, that's the foundation's perspective, but at least to lay the groundwork for that, what we're doing is we just released an RFP. We received $200,000 from the federal government to conduct a study.
Steve, you're breaking up a little bit. I don't know if you can move.
We received $200,000 from the federal government to conduct a study.
It's better.
Excellent. So my apologies. So we released that RFP
I'm not hearing you
recently.
now at all. You're muted.
Excellent.
There you
I
go.
must be having internet connection issues. My apologies, folks. Just know that we are studying entrepreneurship in our area. I will be coming back over the course of the summer with updates. And my sense is that by the time we're done with this, we'll be looking at another federal grant that will bring us a brick and mortar facility to support entrepreneurship, makerspace, hackerspace, tinkerspace. And I look forward to coming back to share those results. Thank you, Steve.
Thank you, Stephen Cole, Executive Director of Plymouth Regional Economic Development Foundation. He'll stay with our panel as we move forward now for our State of the State weekly message from our Plymouth State Representative, Matthew Muratore. Welcome, Matt.
So we're looking at what Karen had to say about vaccine sites. with regard to some of the local sites we have, I know people talk about, you know, Plymouth being the largest community and we should have one in our town. It doesn't work that way. The sites that are being set up aren't being set up for every town. It's being set up for the area. I know one of the things, and I talked about this before, that I know Karen and the Board of Health and the Board of Selectmen have been working on is a super site, along with Kathy Lenatra and Sue Moran and myself in the Kingston collection area, at Kingston Collection. You know, we believe that having a super site for the area would make a lot more sense, and so doesn't the government. So doesn't the state government. However, it's all dependent on the vaccines. So we can't be opening all these other sites when we don't have the vaccine. So it's all supply and demand that I've talked about before. As Karen indicated, we've got close to 1 million vaccines at this point, and we have over 4 million people that need to be vaccinated twice. So that's 8 million vaccines that we're going to need. So we're not there yet, but more sites will be opening. I'm confident there'll be more sites opening in this area over the next several weeks as well. But just so people know, and I think people forget, that within a 20-mile radius of Plymouth, again, depending where you live in Plymouth, if you live in South Plymouth or North Plymouth or West Plymouth, it's probably closer. But we have the Big Y in Kingston, the Stop and Shop in Halifax, and the Hannafords in Middleborough, along with the Marshfield Fairgrounds that just opened up, which is a drive-through. So that's local to us, as well as Skin Esteem Med Spa in Kingston. And all these locations are open 7 days a week. Now, with that being said, tomorrow I have a conference call with B.I. Leahy to talk about a site that they're going to be opening up in Plymouth for their patients. So it's going to be for their patients that they'll be opening up for people over the age of 75. So that'll be another site that will be opening. And with regard to the number of vaccines at these sites, the super sites get the most vaccines. As Karen indicated, there's over 100,000 vaccines that will be posted, or appointments that will be posted starting tomorrow and work throughout the weekend as well. So 74,000 of those appointments will be posted tomorrow. Majority of those will go to the super site, whether it's Gillette or Fenway Park or in Danvers or Springfield. So, you know, and I'm glad, Ken, you brought up about the going to Gillette. I'm hearing a lot of other same stories that it's a great experience going to Gillette and going to these super sites. They're actually more efficient and they're a lot easier than what people think. My own mother-in-law, who is living with stage 4 cancer, lung cancer, she went to Gillette and had a great experience there. So, and matter of fact, it was her first time ever being at Gillette. So, even though I have season tickets, that tells you something about me, I guess. But no, she's never wanted to go, just to clarify. She's never wanted to go, but she had her first experience and it was a great experience. So, but so I do want to let people know that there are locations around this area that have the sites. Thursday is the key day. So Thursday is the day you want to go on, because that's the day we get our allotment from the federal government and you can start making your appointments. So there'll be plentiful appointments at this point. Last Thursday, when it was announced to go ahead and start making appointments, I think by Monday of this past week, there were still about 20,000 appointments still open. So people weren't, so there were plenty of appointments available at that point. So, I think having these sites in these areas are good. More will be coming once we get more vaccines. So I do want to just quickly give the numbers of testing, although the testing numbers don't seem as relevant anymore, but I still think it's important to know that we still are testing. Again, we have 6.9 million people in the Commonwealth. We've actually have individual tests to date of 4.7 million people have been tested individually in the Commonwealth. The total tests have been over 14.5 million tests that have been done. So those are people who've gotten second, third, fourth, and fifth tests. The 7-day positivity rate of COVID has now dropped to below 3. We're at 2.96%, and that compares to 8.57% back at the first of this year. So you can see we're making significant progress. Hospitalizations are down to 1,401, whereas on January 1st, we were almost at 2,500 people in the hospital in the Commonwealth. ICUs are down from 420 to 324. And those that are intubated are down from 264 down to 191. Interestingly enough, though, the folks that are testing positive still, the highest category still is those folks between the ages of 0 and 29 years old at almost 18,000 over the last couple of weeks. And then the second group is 30 to 49-year-old folks, who are 13,000 of those tested positive in the last couple of weeks. And then the 50 to 69-year-olds are 11,600. And the over 70 population was 4,300. So we're still seeing a high amount of the younger population getting tested positive. But again, the good news is these numbers are going down. We will, as we're getting more vaccines in place, you're going to see less testing being done, but the more vaccines will obviously make the bigger difference. So that is the update we have for today, Steve. I just want to say too that in Plymouth County, with regard to vaccines, they are tracking it by county now. We've had over 52,000 vaccinations given in Plymouth County too. So we'll continue to track that as we move forward in the weeks to come. That's it, Steve.
Thank you, and that's Plymouth State Representative Matthew Muratore. You can send your questions to PlymouthInfo@pactv.org. Next Wednesday, our lineup will include, of course, Ken Tavares and Matthew Muratore. We'll be joined by Dr. Philip Triffletti. He's an attending primary care physician at Beth Israel Deaconess. Also, Dr. Barry Potvin, and he is the chair of the Plymouth Board of Health. Carolyn Rains, she is the Director of Health Services for the Plymouth Public Schools. Michelle Brady, she is the Director of Elder Affairs for the town of Plymouth. And the Center for Active Living, Michael Jackman, is our federal partner, District Director for Congressman William Keating, and Amy Naples, Executive Director, Plymouth Area Chamber of Commerce. They'll be here next week to present our Plymouth COVID-19 response to you. At this time, we're going to go back to today's panel, and we're going to be looking for their closing thoughts and what we should remember today from each of them. And we're going to begin with Sarah Cloud, the Director of Behavioral Services at Beth Israel Deaconess in Plymouth. Sarah, before we went on air, we talked about the stress that people of all ages are feeling, both with hospitalizations and unfortunately even with suicide. What can you share with our viewers?
I want to acknowledge that we're all exhausted at this point in the pandemic, and the pandemic is going to leave a significant mark on both our physical and our mental well-being. We know that our children need to return to a consistent schedule. We know that school professionals need to feel and be safe in the workplace, and that parents need a break from the multiple roles they're juggling, but it's complicated. And as Steve, you noted, we have an amazing team of professionals and specialists working on this to pull together a plan and to help continue to guide us through this. So I think what we need to continue to do is be patient a bit longer by focusing what energy we have left and we can muster at this point in this marathon on what's within our control and trying to let go what is, everything else. I'd like to share a quote in closing by Bruce Lee about patience. And he says, "Patience is not passive. On the contrary, it is a concentrated strength." So I really want to encourage folks to continue to stay strong and take good care of themselves and each other.
Thank you, Sarah Cloud. Good words to live by. She is the Director of Behavioral Health at Beth Israel Deaconess in Plymouth. We remind all our viewers, get plenty of rest, get your exercise, and visit with us each week as we come to you live on PAC TV. We're now going to return to Karen Keane, Director of Public Health for the town of Plymouth. Karen, you've got quite a job there as the Director of Public Health in Plymouth. How can people contact you if they have questions?
They can call our office at 508-747-1620. We can dial, as soon as the person starts talking on the recording, you can dial 10118. You can send emails to us, Plymouth Public Health. Actually, you can send them to me, Keane, so it's KKEANE, at plymouth-ma.gov. We also have our website and our department website as well, off of the town's website, which is www.plymouth-ma.gov, and you can go on that website and then connect to us through that as well. So we're soon going to be open again to the public. And then we always welcome the public to come into our office. We're on the first floor of the town hall. We're not quite open to the general public quite yet, but we will be doing that soon. And we encourage folks to come in if they have any questions or concerns, right into the office here on the first floor of the town hall. Two things I want to echo from what other people said as my parting remarks. One was from Matt Muratore when he talked about BID setting up the clinic in Plymouth at Pier 1. I met with BID today, and an interesting statistic they shared with us. That site, even though it is strictly for people who are connected to BID Plymouth as patients, either because they use their services as an inpatient or an outpatient, or they see a doctor that belongs to their network, they estimate that 70% of the people that go there will be Plymouth residents. So I thought that was a pretty impressive number. I'm also going to echo Sarah Cloud when she talked earlier about the three things that we can do, that we can continue to do as we receive vaccinations. These are still so important. These are the foundations of how we're going to stop COVID. And that is wear your mask, social distance, and wash your hands. And I really want to thank everyone for all their efforts that they're doing to stop the spread here in Plymouth.
Thank you. And that's Karen Keane. She's Director of Public Health for the town of Plymouth. We're now going to go to Dr. Christopher Campbell, Superintendent of Plymouth Public Schools. And Dr. Campbell, you service not only the students, but the teachers, the staff, the administrators. If people need to access the schools, where do they go? What do they do?
Well, certainly there's a lot of ways, Steve, to access the schools. Certainly I would encourage people to reach out to their building administrator if they have any questions or concerns. They could always call our office here at Central Office, talk to myself or our Director of Health Services if they have any questions, and also through email. But we encourage people to reach out to building administrators first. We're always here and always available. I want to echo Sarah's comments about patience, and I just truly appreciate everyone's patience as we've tried very hard to make decisions which we feel are best for everyone involved, our staff, our students, and our families. And it certainly hasn't been easy, and there've been bumps along the way, but we're trying to balance everything and do what we feel is in the best interest of everyone. So, with everyone's support, we've been able to continue to provide in-person education during the pandemic. It's our hope, as I said earlier, that this experience will not only continue, but will reach our goal of offering a full-time model in the coming weeks. So by exercising our safety protocols in schools and with everyone's continued support at home, we've been able to continue this model since September. And while our schools are working hard to help prevent the spread, it's really important that we continue our practices outside of school because we always have the concern about increase in community spread. So as we approach February break, because at the end of this week we'll enter our February break, we just want to encourage everyone to continue to exercise caution with social gatherings and travel. We ask that everyone be vigilant in protecting yourself and others during the break. None of us likes the restrictions imposed by the pandemic, but we do ask you to follow the guidelines for travel and plan to quarantine upon return if necessary. So the Massachusetts Department of Health travel advisory can be found on the mass.gov website by searching travel order. And we'll be sharing that information later today too as a reminder. Just lastly, I'd just like to wish our entire school community a happy winter break. To our students and to our staff to really, I hope that you have a chance to relax. And I just want to express my sincere gratitude for the personal sacrifices and patience that everyone has shown to keep our schools open and keep our communities safe. And as always, Steve, as you asked at the beginning, if anyone ever has a question at any time, please feel free to contact your school administrator, our Director of Health Services, or my office. Thank you, Steve.
Thank you. And that is Dr. Christopher Campbell, Superintendent, Plymouth Public Schools. This time we return to Heather Cozby. She is a CPA in the town of Plymouth. Heather, lots going on in your world now as tax season is well underway.
Yes, it is. And I really enjoyed the Bruce Lee quote, who I enjoy Bruce Lee's quotes all the time, but patience, patience, patience. And then you add the stress of everybody getting almost ready to be out of this. And then you add money onto it with like refunds being delayed. So be patient. You know, all the practitioners in town that are helping people with their taxes, everybody's doing their best. We have a little bit more to get through. It's always great to be on this panel to get all of this information direct. I so appreciate the opportunity and hearing everybody. And I just want to close with, I can't go a week without talking about PPP. So, I just want to bring it up and say, I still have not seen the one-page application for loans under 150,000 implemented. So continue to wait for that forgiveness form. Do not feel like you have to rush into it. Nobody's asking for them. Just wait for that one-page forgiveness form. Get out there, get your round 2 money if you qualify, and do your best planning to get out of this winter and get ready for spring and hopefully some wonderful tourism here in Plymouth. But thanks again.
Thank you, Heather Cozby, Plymouth CPA. And now we return back to Stephen Cole. He's the Executive Director, Plymouth Regional Economic Development Foundation. Steve, your closing thoughts.
Thanks, Steve. I hope I'm coming through clear enough this time. I'll have to talk to my landlord about the internet connection. So what I want to remind folks, and I've said this time and again, if you don't have the job you want, or if you don't think your job will be there at the end of all of this, it may not feel like the right time to start your own business. But I do want to encourage folks to start thinking about the type of job you do want to have, the type of business you do want to create with the types of jobs for your friends and your family. We at the foundation are laying the groundwork right now with our state and federal partners to support entrepreneurship in our area. We don't talk an awful lot about it, but I know innovation lives here. I've seen it. And one of the things I really want to stress too is that artists can be small business owners also. Artists can be entrepreneurs also. So you might hear me use the word entrepreneur a little bit, but one of the things we're going to do is create a robust economic development strategy that supports entrepreneurs, a business that helps create businesses. Thanks, Steve.
Thank you, Stephen Cole, Executive Director of Plymouth Regional Economic Development Foundation. Matthew Muratore, this is number 85 in our presentations. What should we be thinking about today at the state level?
Well, it feels like that's my age too at this point, but with regard to the state level, I think I just want to remind people that your 2 friends are calling 211 if you have questions about vaccines. If you need help getting appointments with vaccine, call 211. That's just been set up. And mass.gov /COVID vaccine is the website. They get you all the sites in the area, where they are, how to get appointments. There's all sorts of information on there. So those are your 2 friendly places to go for vaccines. And I think the people are talking today about patience. I love being with this panel and all the good quotes they have. And thinking about this, we're all real patients in this. We actually are patients waiting for our shots. And so we need to practice the patience as a patient. So I think we need to continue to do that. We will get there. And as Walt Whitman said, be curious, not judgmental. And we'll see you next week, Steve.
Thank you, Matthew Muratore, Plymouth State Representative, and Ken Tavares, Chair of the Select Board. You've been patient. You started off this program, and you listened to everybody speak twice before we come back to you. What should we remember today?
Had to unmute first, Steve. The key word today is patience, and we have certainly talked about that in past months, and it is certainly during these tough times difficult to practice, but it's what's gotten us this far, and I'm sure that we're going to continue to be successful. So I also recommend that as a takeaway that we all spend a little bit of time on ourselves. And it's not a sin to break away and try to relax in different ways, whether it's reading a good book, listening to some music, or working on a project that gives you pleasure. So we certainly all need a great deal of patience. Also, I want to remind everyone that if you haven't purchased a Valentine's gift, a phone call to get a vaccination might be a really great gift, and especially 75 and over. if you can bring someone with you, it's a 2-for-1 special. So think about it.
Pick me.
And Rep. Muratore is definitely going to take advantage of that. And the price is right, Matt?
That's right. I'll bring somebody. Anybody wants me to go with them, I'll go with them.
Okay. All right. Have a good week. This panel, as always, is extraordinary, and I think we've got some good words to live by for the rest of the week. Thank you, Steve.
Thank you, Kenneth Tavares, Chair of the Select Board for the Town of Plymouth. Wise words to remember as we close out today. And we thank all the members of the panel who also joined us with Matt Muratore, and they are Sarah Cloud, also Karen Keane, Dr. Christopher Campbell, Heather Cozby, and Stephen Cole. And again, joining us next week, Dr. Philip Triffletti, Dr. Barry Potvin, also Carolyn Rains will also be joined by Michelle Brady, also Amy Naples, and Michael Jackman. We're here each Wednesday on PAC TV. Special thanks to Julie Thompson, Executive Director for PAC TV, and for all her staff who have supported us throughout the past year. There's no wonder why they got that special award as Plymouth's leading business during 2020. And at this time, we're going to close. We thank you for joining us. I'm Steve Triffletti, Plymouth Town Moderator, and good day.